Good morning, I am Dr. Nghia, and I am honored to be here today from Vietnam National Hospital. The topic of my presentation is geriatric anesthesia in Vietnam, current situation and potential opportunities. As life expectancy continues rising in Vietnam, we are facing an increase in our elderly population. In my presentation today, I will provide an overview of the current landscape of geriatric anesthesia in Vietnam, by trying and grab, as well as evidence-based strategies we can implement to optimize outcomes for our aging surgical patients. Your global expertise and perspective will provide valuable insight as we work collaboratively to advance geriatric anesthesia services in Vietnam. Thank you for the opportunity to present on this critical topic. In this project, I have no disclosure or conflict of interest to report. My presentation have two parts. The first part is general overview of demographic trends in Vietnam, medical issues in Vietnamese elderly as compared to other countries. The second part is specific example, Vietnam National Lung Hospital, clinical and research focus, challenges and needs. Let's move to the first part. Vietnam is undergoing major demographic changes as a result of declining birth rates and rising life expectancy. According to statistics, Vietnam now has over 11 million residents aged 65 and older, comprising 11.5% of total population. This proportion of elderly individuals is expected to reach 17% by 2030. An aging population has significant impacts on healthcare needs. Chronic diseases are increasing as people live longer. The elderly have more comorbidities and medically complex conditions that require hospital services like surgery. Healthcare system must adapt to meet the needs of his growing elderly population. In particularly, anesthesia providers will see more older surgical patients with age-related health factors. There is an urgent need to prepare for this incoming wave of elderly patients requiring surgery. Steps must be taken to ready to healthcare workforce, upgrade resources, and implement elderly-specific clinical protocol. Proactive preparation is key to providing equally surgical care for Vietnamese Asian population. Vietnam have 100 million at the age of over 65, 11.4 million equal 11.4% at the age of over 80, 2 million equal 2%. Trend expected to continue in the future, 17% in 2030 and 25% in 2050. The aging have impact on the population, especially with the chronic diseases, hypertension 30%, diabetes 5%, CVD 7%, higher utilization of healthcare hospital, 40% of total procedures are currently performed in elderly population. There is a clear sense of urgency to prepare to meet the needs of this growing population. Differences in Vietnamese elderly to compare to other countries. Elderly population in Vietnam have a unique attribute and healthcare needs stemming from historical events and the developing economic status of the nation. Many older Vietnamese adults face trauma and hardship during the war, leading to higher rate of PTSD, chronic pain and disability and malnutrition. Cultural perspective on healthcare also influenced the elderly's approach to accessing services. Traditional remedies are still utilized by many. Lower health literacy rates exist, especially in rural regions with limited healthcare access. Tropical diseases like tuberculosis and fungal diseases persist. Cancer rates are rising. Developing nations contrast on resources and technology also impact healthcare capacities. Appreciate this distinction is important to provide optimal, culturally appropriate care for Vietnamese elderly patients. Models adopted from Western nations must be adapted to fit local context. A thorough understanding of Vietnamese geriatrics and appreciating this complex interplay of history, culture, and environment is key to providing optimal elderly care in Vietnamese context. Vietnam has seen rapid economic growth, leading to an emerging wealthy class who can access advanced medical care for aging parents, including services abroad. There is increasing willingness to pay for quality care. At the same time, internet and smartphone uses are surging with over 70% of Vietnamese online today. This digital connectivity provides new opportunities to improve elderly care through online education, telehealth, remote monitoring apps, and more, ensuring continued development of equitable, affordable care remains vital. As incomes and technology rise, Vietnam's healthcare system must balance high-tech solutions tailored to younger users with accessible traditional care models that provide person-to-person support to broader elderly population. Let's move to the second part. Let me introduce our hospital, Vietnam National Lung Hospital. It's the biggest hospital for lung diseases in the north of Vietnam. We are 1,000-bed hospital for lung diseases, take responsibility for 30,000 patients per year. Our research focus infectious lung diseases, stem cells, lung surgery, and lung transplant. We are also developing international collaboration with USA, UK, Thailand, Korea, and Japan. As you can see here, this is one of my operation room. It is beautiful, isn't it? Well, we have a 12 operation room like this, with well-equipped instruments, including ventilator, monitor, CPB, ECMO, etc. Annually, we perform around 1,700 complicated fast cases, mostly are lobotomies. With this capacity, we have some achievement in National Lung Hospital. We can do every complicated surgery, even the lung transplant. The video here is the most successful lung transplant case in Vietnam now. He's at the 4th year post-bilateral lung transplant and is still being well. We also have some successful lung surgery on elderly more than 90 years old. In 2023, we performed a total of 2,436 surgical cases. The case over 65 years old is 592 cases, equal 24.3%. We have 30 cases more than 80 years old. Among of surgical procedure, 75.8% is lung surgery, and the left are orthopedic surgery and other surgery. We have done 170 cases lobotomy for elderly and 263 cases of decortication in 2023. Currently, we have 47 full-time staff anesthesia faculty, including 9 doctors, 31 nurses, and 7 other staff. Primary focus is clinical care. There is no defined subspecialty training in Vietnam, only limited emphasis on geriatric anesthesia, new trend in Vietnam. Major shortcoming we would like to address lack of research. There are some researches from our lung transplant team you can see here. And why we have excellent outcomes. As we can see here, this is a 90 years old man with impairment post-decortication at National Lung Hospital in the first day. The right side is the 100 years old female post-total hip replacement in other hospital. We really need education resources, improve clinical knowledge skill, anesthesia in elderly patients, establish foundation for research, ability to collect and analyze clinical data, research quality improvement. And now, let's change gears and discuss anesthesia activities in more granularity, starting with preoperative assessment and optimization. Pre-operative assessment and optimization is crucial in elderly surgical candidates. What we have? Limited preoperative clinic, especially high-risk elderly patients. Minimal rehab and conditioning program. Lack of protocol for rehab and nutrition care. Lack of mental support resource and consultant about the surgery due to the overload. We need comprehensive preoperative clinic for the elderly that would include and address faulty preoperative optimization, nutrition support, etc. Improvement of mental support and consultant for the elderly. Second, anesthesia equipment. Why we do have standard and advanced equipment, including ventilator, neuromuscular monitoring, depth of anesthesia, arterial, central, and pico catheter monitoring, and pico. We do suffer from limited availability to advanced anesthesia machines. The lack of electronic medical record system is also the major handicap. Lastly, we increasingly miss the lack of TEE for more complex cases like lung transplantation. Close monitoring during surgery is crucial for elderly patients. Standard monitor like ECG, blood pressure, pulse oximetry should be utilized along with capnography to detect respiratory status changes. Additional advanced monitor like bispectral index for depth anesthesia, cerebral oximetry, and neuromuscular blockade monitoring provide valuable data to guide care. Accurate fluid management guided by parameters such as CPP and urine output is key. Validator setting must be adjusted based on factor of life comorbid lung disease. Multimodal general anesthesia combined with regional nerve block enhance outcomes. Electronic documentation from integrated monitor improve quality control. Enhance monitoring enable early detection of abnormality so intervention can be taken promptly when needed. Our current intraoperative anesthesia. In France, we use general anesthesia with epidural and advanced monitoring only in selected patients. In orthopedic surgery, we use general anesthesia with epidural regional nerve blocks. Shortages, medication, consumable, blood products. We need adequate supply of medication and consumable, education resources to better understand the effect of anesthesia and surgery on aging patients. Utilize the data obtained from monitors to guide care in a high-risk patient. Ability to share and exchange experiences and clinical data to guide progress. And next, post-operative pain management. Currently, we practice continuous epidural and nerve block catheter, multimodal and analgesia, tinoids and set gabapentinoids, IV opioids as needed. We need education resources to expand regional anesthesia program, use of ultrasound for regional anesthesia, incorporate more effectively adjuvant medication, for example, ketamine, dexamethasone, non-pharmacologic modality, for example, TENS, cryotherapy. Last but not least, our anesthesia service lacks research activate in general and in particular when it comes to geriatric population. There is a lack of aggregated nation data on outcome of geriatric anesthesia in Vietnam. Establishing a database to analyze practice to results would inform quality initiative. Coordinated data collection using standardized measure is needed to benchmark performance. Dedicated research program focused on geriatric anesthesia best practice are limited, but such a collaboration presents opportunity to generate evidence and publish guidelines. Global partnership facilitate knowledge sharing. Applying for public and private research funding is important to drive progress. Robust data provides insight on how to continually improve anesthesia care for the elderly. Ongoing research analytics are key to keeping pace with the needs of an aging population. In conclusion, as Vietnam experiences growth of an aging population, proactive initiatives are urgently needed to advance a geriatric anesthesia service. Our hospital is very reflective of other institutes. As such, there is a plethora of opportunity for improvement of development in Vietnam. Starting with effort to increase the awareness and education of geriatric anesthesia, improving clinical care of elderly patients is key in order to face this new challenge. Key steps here include updating provider education and training, implementing evidence-based clinical protocols, and bring in global expertise. Lastly, it is crucial to get ahead of this strong demographic trend by establishing robust research program. And here we do need expert advice on how to make this process successful. Definitely, there are challenges, but also tremendous opportunity to position Vietnam at the forefront of optimized surgical care for our aging society. With coordinated effort, we can build a responsive system and highly capable workforce skilled in delivering modern, high-quality, equitable geriatric anesthesia. I would like to thank my mentors and collaborators, without whom my work would not be possible. Dr. Đinh Văn Lượng, Director of Vietnam National Lung Hospital, Professor Marek Brzezinski, the Society of the Advancement of Geriatric Anesthesia, Professor Jocelyn Cucurella, UCSF Medical Center, National Lung Hospital Lung Transplant Team, Anesthesiology Department. I would like to say thank you for your time and attention. Should you have any question, please do not hesitate to reach out to me. My email is here. I truly hope my talk is the first step in establishing strong international collaborative efforts. Thank you.